In this Medmastery lesson, we'll explore long QT syndrome and how it presents on an ECG. This case-based lesson will help you practice recognizing key ECG features and understand their significance when diagnosing long QT syndrome in children. Our patient is a 17-year-old soccer player that experienced exertional syncope, a sudden loss of consciousness during physical activity while running on the field. Immediately after her syncopal event, she was noted to be without a pulse and she was not breathing. Her coach reacted quickly, called for an AED or automated external defibrillator, and began chest compressions. Fortunately, our patient started waking up as soon as the AED arrived. The patient was taken to the emergency room and an ECG was obtained. Let's take a look at that ECG and review the rhythm, rate, and axis. Rhythm assessment shows a P wave before every QRS complex and a QRS complex after every P wave. The P wave axis is upright or positive and leads 1 and AVF, indicating sinus rhythm. Using the grid lines on the ECG, calculating the heart rate reveals a rate of about 85 beats per minute, perfectly normal. Now we examine the QRS complexes, which are downward in lead 1 and upright in AVF. These findings suggest mild right axis deviation. Now let's look at the intervals. The duration of the PR interval and QRS complex is normal, but the QT interval, even to the naked eye, looks longer than normal. The QT interval reflects the total time taken for the ventricles to contract, depolarize, and then relax, repolarize in a single heartbeat. On this ECG, the QT interval is measured to be 480 milliseconds, with an RR interval of 700 milliseconds. If we apply Bazett's formula, we can calculate the corrected QT by dividing the measured QT interval by the square root of the measured RR interval. Let's start by converting the RR interval and the QT interval from milliseconds to seconds. Now using Bazett's formula, divide the QT interval of 0.48 seconds by the square root of the RR interval, 0.7 seconds, which gives us a corrected QT of 0.57 seconds, or 500 milliseconds. Wow. If you remember, the QTC should be less than 470 milliseconds. This degree of QTC prolongation is diagnostic of long QT syndrome. Long QT syndrome is an inherited heart rhythm disorder that can cause sudden death from malignant ventricular arrhythmias. Ion channels, tiny little pores in the cell membrane, tightly regulate heart muscle depolarization and repolarization. When ion channels do not function normally, which is the case in long QT syndrome, the flow of ions in and out of the heart cells is disrupted. This delays the heart's ability to repolarize or recharge, which we see as a prolonged QT interval on the ECG. This condition causes the heart to be vulnerable to developing very fast ventricular arrhythmias that can lead to sudden death. These arrhythmias typically occur during exertion, as was the case in our patient. Fortunately for our patient, her arrhythmia spontaneously converted and no immediate intervention was required. She recovered fully after her event. Once we diagnosed her with long QT syndrome in our office, we quickly started her on medication, and she has done great since, with no recurrence of symptoms for the last 12 years.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how Medmastery can help you become a great clinician, make sure to watch the About Medmastery video. So thanks for watching, and I hope to see you again soon.